So moving on now to the detailed questions. So question 4 is a detailed question which goes into more detail about blinding. Some people call it blinding, some people also call it masking. So when you're looking at a randomised controlled trial paper, you need to see whether the authors describe whether the participants were blind, whether the clinicians or the healthcare workers were blind, and whether the study personnel who were maybe assessing the clinical outcomes were blind to which participants had the treatment and which participants had were in the control group who may have had a placebo. So for example, it's possible in studies of, say, toothpaste to have participants blind to whether they are receiving an active toothpaste or whether they are receiving a placebo toothpaste, which may look and taste exactly the same but may not have the kind of active or test ingredient. So that's blinding. So typically a good study would describe whether the participants, the clinicians, the assessors were blind, and if they were not blind, some sort of discussion about why blinding was not possible. Question 5 is about whether the control group and the intervention group were assessed to see whether their characteristics at the start of the trial were similar. And this is important because any differences in the characteristics of the groups before the trial are relevant, because if you find differences between the groups at the end of the trial, you won't know whether those differences are due to the intervention or they were due to differences that the group started off with. So we typically see in papers a description in the method and the results of some sort of description about whether the groups were, how the researchers tried to make sure the groups were similar at the start, and then something perhaps in the results that say whether there were any differences between the groups and how those differences, any differences between the groups, were accounted for in the analysis, and then some sort of discussion about whether any differences between the groups, a discussion of how that might affect the outcome of the trial. So you're looking, when you read the paper, for references, so something in the text that talks about whether there were differences between the groups at baseline, what those differences were, and whether any differences might, how they might affect the outcome of the trial. Moving on now to question 6. Question 6 is a similar kind of question, which is also thinking about how the groups were treated during the trial. So we would expect that there would be differences between the groups because one would have the intervention and one would be the control. But other than that, we would expect the groups to be treated equally. So we would expect them to be seen and have their assessments done at a similar time point. We'd expect them to be followed up in the same way, and we'd expect them to be followed up for over the same time period. So this question is really concerned with the sort of method, the procedure of how the groups were treated during the time they were in the study. So those first 6 questions are really focused on establishing the validity of the study